Paxlovid, a complete drug review. Hi everyone, and welcome to a special edition of the PharmEasy Tutor. Today I'll be presenting a new drug spotlight on Paxlovid, an antiviral for the treatment of COVID-19. This will be a concise review that hopefully will provide you with everything you'll need to know about Paxlovid. Paxlovid is the first oral antiviral at-home treatment for COVID-19. It's considered a game changer since it does not require IV infusion of a drug such as with monoclonal antibodies. Patients can easily fill the Paxlovid prescription at their local pharmacy and take the drug at home, starting therapy with minimal delay. Paxlovid is a combination of two distinct drugs, Nirmatrelvir and ritonavir. Both drugs are protease inhibitors. Protease inhibitors are a family of antiviral drugs that have been used for decades. They revolutionized the treatment of HIV and hepatitis C and have a known safety record. Nirmatrelvir functions primarily as the main antiviral. It blocks a key enzyme that viruses need to multiply in the human body. Ritonavir, on the other hand, is used to boost the effectiveness of Nirmatrelvir. Ritonavir is administered with Nirmatrelvir as a pharmacokinetic enhancer, resulting in higher systemic concentrations and a longer half-life of Nirmatrelvir, thereby supporting a twice-daily administration regimen. Ritonavir slows down Nirmatrelvir's breakdown to help it remain in the body for a longer period at higher concentrations. Paxlovid is manufactured by Pfizer. Since it's a combination drug, I'll refer to it by its trade name Paxlovid throughout this lecture, rather than by its two generic names. Paxlovid is taken twice a day for 5 days. Serious drug-drug interactions can occur with several key drugs and can contraindicate the use of Paxlovid. The EPIC-HR trial was where Paxlovid was clinically studied. Compared to placebo, patients treated with Paxlovid showed decreased COVID-19 hospitalization through day 28 and reduced all-cause mortality through day 28. Paxlovid received Emergency Use Authorization (EUA) from the FDA for the treatment of recently diagnosed COVID-19 in December of 2021. The drug remains investigational and is currently not officially FDA approved for any indication. The U.S. government purchased 10 million courses of Paxlovid for $5.3 billion, which amounts to a cost of $530 per course. Supplies will be limited at first. Paxlovid is authorized for use for treatment of mild to moderate COVID-19 disease in adults and pediatric patients who are 12 years of age and older, weighing at least 40 kilograms, and who are at high risk for progression to severe COVID-19, including hospitalization or death. Patients must have a positive result of COVID-19 viral testing. Paxlovid should be administered as soon as possible after positive viral tests and within 5 days of symptom onset. So what does it mean by high risk for progressing to severe COVID-19 and/or hospitalization? High risk is defined as patients who meet at least one of the following criteria in the following table. As you can see, there are many conditions where a patient can have that will allow them to be considered high risk. Paxlovid is not authorized for initiation of treatment in patients requiring hospitalization due to severe or critical COVID-19 infection. It's also not authorized for use as pre-exposure or post-exposure prophylaxis for prevention of COVID-19. Paxlovid is also not authorized for use for longer than 5 consecutive days. The EPIC-HR trial evaluated the effect of Paxlovid in non-hospitalized patients with laboratory-confirmed diagnosis of COVID-19 infection who are at high risk of developing severe COVID-19 illness. This was a randomized, double-blind, placebo-controlled study. 2,224 adult patients with symptom onset less than or equal to 5 days were studied. 66% of subjects had onset of symptoms less than or equal to 3 days from initiation of study treatment. Paxlovid was given twice a day for 5 days compared to matching placebo. The study excluded individuals with a history of prior COVID-19 infection or vaccination. The primary SARS coronavirus variant across both treatment arms was Delta, 98%. Mean age of patients was 46 years, 51% were male, 72% were white. Here are the efficacy results of the EPIC-HR trial. When we look at COVID-19 related hospitalization or death from any cause through day 28, which is the primary endpoint, Paxlovid reduced that percentage from 6.3% to 0.8%, with a relative rate of reduction of 88%. Looking at all-cause mortality through day 28, placebo patients had 12 patients who died. Paxlovid group had none who died. As we earlier stated, Paxlovid is a combination of two drugs, Nirmatrelvir and ritonavir. Nirmatrelvir is a protease inhibitor of the COVID-19 main protease, Mpro. The COVID-19 main protease Mpro is also referred to as 3C-like protease or NSP5 protease. Inhibition of the COVID-19 main protease renders the virus incapable of processing polyprotein precursors, thus preventing viral replication. Let's first talk about how the virus replicates itself. After the virus attaches to the cell, it releases its viral RNA. Ribosomes on the RNA produce polyprotein chains. These long protein chains are cleaved by enzymes called proteases into smaller viral proteins. The viral proteins forms a complex which then leads to RNA replication. Final assembly and release of new virus then occurs to complete the process. Nirmatrelvir, contained in Paxlovid, is a protease inhibitor, so it blocks the main protease 3CL and prevents the breakdown of the polyprotein chains into smaller segments. This ultimately prevents RNA replication and stops further viral production. What about the mechanism of action of ritonavir? Ritonavir is an HIV-1 protease inhibitor and a CYP3A inhibitor. Ritonavir is a protease inhibitor, but it is not active against the COVID-19 Mpro. Ritonavir primarily inhibits the CYP3A-mediated metabolism of Nirmatrelvir, resulting in increased plasma concentrations of Nirmatrelvir. Ritonavir is administered with Nirmatrelvir as a pharmacokinetic enhancer, resulting in higher systemic concentrations and a longer half-life of Nirmatrelvir. Here's a diagram of Nirmatrelvir undergoing cytochrome P450 enzyme-mediated metabolism in the liver, resulting in inactive metabolites. When we give ritonavir concurrently with Nirmatrelvir, there's an inhibition of the cytochrome P450 enzyme system in the liver, resulting in slower breakdown of Nirmatrelvir and higher therapeutic concentrations of the antiviral. Let's talk a little bit about Paxlovid's microbiology. Nirmatrelvir exhibited antiviral activity against the SARS coronavirus USA Washington 1-2020 isolate. Nirmatrelvir had similar cell culture antiviral activity against the SARS coronavirus isolates belonging to the alpha, beta, gamma, delta, and lambda variants. The beta variant was the least susceptible tested variant. No data are available regarding the activity of Nirmatrelvir against the SARS coronavirus Omicron variant in cell culture. However, in a biochemical assay, the Mpro P132H substitution found in the Omicron variant did not reduce Nirmatrelvir activity compared to the USA Washington 1-2020 enzyme. Paxlovid is Nirmatrelvir tablets co-packaged with ritonavir tablets. Nirmatrelvir comes as 150 mg pink film-coated tablets. ritonavir are 100 milligram white film-coated tablets. The dosage for Paxlovid is Nirmatrelvir, 2 150 milligram tablets or 300 milligrams, with ritonavir, 1 100 milligram tablet, with all 3 tablets taken together orally twice a day for 5 days. Each daily blister card contains 4 Nirmatrelvir tablets, 150 milligrams each, and 2 ritonavir tablets, 100 milligrams each, and indicates which tablets need to be taken in the morning and evening. Each carton contains 30 tablets divided in 5 daily dose blister cards. The treatment course of Paxlovid should be initiated as soon as possible after a diagnosis of COVID-19 has been made and within 5 days of symptom onset. Paxlovid can be taken with or without food. The tablet should be swallowed whole and not chewed, broken, or crushed. Store at controlled room temperature. If a patient misses a dose within 8 hours of the time it is usually taken, tell the patient to take it as soon as possible and resume the normal dosing schedule. If the patient misses a dose by more than 8 hours of the time it is usually taken, the patient should not take the missed dose and instead take the next dose at the regularly scheduled time. Do not double the dose to make up for a missed dose. Also, should a patient require hospitalization due to severe or critical COVID-19 after starting treatment with Paxlovid, the patient should complete the full 5-day treatment course per the healthcare provider's discretion. Does the dose of Paxlovid need to be adjusted for renal impairment? Well, for patients with glomerular filtration rates greater than 60 mL per minute, no dosage adjustment is needed. However, if the GFR is between 30 to 60 or moderate renal impairment, the dose of Paxlovid should be reduced to 150 milligrams of Nirmatrelvir, which is 1 tablet instead of 2 tablets, taken with 100 milligrams of ritonavir twice a day for 5 days. In severe renal impairment with a GFR less than 30 mL, Paxlovid is not recommended. What about with patients with hepatic impairment? No dosage adjustment is needed for mild to moderate hepatic impairment or Child-Pugh class A or B. However, with severe hepatic impairment, Child-Pugh class of C, the use of Paxlovid is not recommended. Regarding pharmacokinetics, we can see that Nirmatrelvir is primarily eliminated renally with minimal liver metabolism. However, ritonavir has significant liver metabolism through the cytochrome P450 system, a major portion through the CYP3A4, and a minor portion with the CYP2D6 metabolic enzymes. The half-life of both drugs is approximately 6 hours. Many drug interactions can occur with Paxlovid and commonly used medications. This can prevent the use of Paxlovid in many situations. Let's talk about them right now. First, let's talk about the potential for Paxlovid to affect other drugs. Ritonavir, contained in Paxlovid, is a strong inhibitor of the CYP3A metabolic enzyme system in the liver and may increase plasma concentrations of drugs that are primarily metabolized by CYP3A. Co-administration of Paxlovid with drugs highly dependent on CYP3A for clearance may lead to elevated plasma concentrations of the drug, resulting in serious and/or life-threatening events from greater exposures. The patient's medication list should be reviewed by the pharmacist and healthcare provider prior to Paxlovid therapy for the potential for drug interactions. Co-administration with other CYP3A substrates may require a dose adjustment, additional monitoring, or a switch to an alternate COVID-19 antiviral drug. As we saw earlier, ritonavir can inhibit the cytochrome P450 enzyme system in the liver, thus decreasing the metabolism of Nirmatrelvir and leading to increased levels of the antiviral. Like Nirmatrelvir, several drugs are metabolized by the cytochrome P450 enzyme system in the liver. The addition of ritonavir will inhibit the cytochrome P450 enzymes, thus reducing the normal metabolism of these drugs and leading to elevated and possibly toxic drug levels. This is why certain medications are contraindicated. Paxlovid is contraindicated with drugs that are highly dependent on the CYP3A for clearance, and for which elevated concentrations are associated with serious and/or life-threatening reactions. These medications include those that are bolded: amiodarone, flecainide, colchicine, clozapine, lovastatin, simvastatin, sildenafil when used for pulmonary artery hypertension, and triazolam. Now let's talk about the potential for other drugs to affect Paxlovid. Nirmatrelvir and ritonavir are metabolized by the CYP3A metabolic enzyme system. Certain drugs can induce the CYP3A enzymes, thus decreasing Nirmatrelvir and ritonavir plasma concentrations and reduce Paxlovid's therapeutic effect. As a result, loss of therapeutic effect of Paxlovid and possible development of viral resistance may occur. We previously saw how ritonavir inhibited the cytochrome P450 enzyme metabolism of Nirmatrelvir, leading to increased levels of Nirmatrelvir. Certain medications that patients take may also stimulate the cytochrome P450 system, making it work faster. If Paxlovid is given along with these medications, Nirmatrelvir will be metabolized more, leading to lower and subtherapeutic levels of the antiviral. This is why these medications are contraindicated. Paxlovid is contraindicated with drugs that are potent CYP3A inducers, where significantly reduced Nirmatrelvir or ritonavir plasma concentrations may be associated with the potential for loss of virologic response and possible resistance. Paxlovid cannot be started immediately after discontinuation of any of the following medications due to the delayed offset of the recently discontinued CYP3A inducer. Some of these drugs include carbamazepine, phenobarbital, phenytoin, rifampin, and St. John's wort. Finally, there are additional established and other potentially significant drug interactions that can occur with Paxlovid. The following tables, seen over the next few slides, provide a listing of clinically significant drug interactions, including contraindicated drugs. I will highlight them as we go along each table. Drugs listed are used as a guide and not considered a comprehensive list of all possible drugs that may interact with Paxlovid. The healthcare provider should consult appropriate references for comprehensive information. Important drugs that may interact with Paxlovid include those that are circled in red over the next few pages. I'll provide a link in the comments section where this complete list can be accessed. Paxlovid is contraindicated in patients with a history of clinically significant hypersensitivity reactions to its active ingredients, Nirmatrelvir or ritonavir, or any other components of the product. There are limited clinical data available for Paxlovid, so serious and unexpected adverse events may occur that have not been previously reported with use. Hepatotoxicity, hepatic enzyme elevations, clinical hepatitis, and jaundice have occurred in patients receiving ritonavir. Therefore, caution should be exercised when administering Paxlovid to patients with pre-existing liver diseases, liver enzyme abnormalities, or hepatitis. While there are no available human data on the use of Nirmatrelvir during pregnancy, published observational studies on ritonavir used in pregnant women have not identified an increase in the risk of major birth defects. Regarding lactation, there are no available data on the presence of Nirmatrelvir in human or animal milk. Limited published data reports that ritonavir is present in human milk. Regarding overdosage, treatment of overdose with Paxlovid should consist of general supportive measures. There is no specific antidote for overdose with Paxlovid. Carcinogenicity studies have not been conducted with Nirmatrelvir. Nirmatrelvir was negative for mutagenic or clastogenic activity in vitro and in vivo assays. Carcinogenicity studies in mice and rats have been conducted on ritonavir. In male mice, there was a dose-dependent increase in the incidence of adenomas and carcinomas in the liver. The following table lists the adverse events in the Paxlovid group that occurred at a frequency greater than or equal to 1%. At the top of the list is dysgeusia, or an altered sense of taste. This occurred in 6% of Paxlovid patients versus less than 1% of placebo patients. Other side effects included diarrhea, hypertension, and myalgia. The percentage of patients that discontinued treatment due to an adverse event was higher in the placebo group, 4%, versus 2% in the Paxlovid group. Reporting of all medication errors and serious adverse events involving Paxlovid is mandatory. This involves completion of the FDA MedWatch form within 7 calendar days from the onset of the event. The form should be completed and submitted online to the following site. Also, a copy of the FDA MedWatch form needs to be sent to Pfizer at the following website or fax number. A copy of the Paxlovid fact sheet must be provided to the patient prior to the patient receiving the drug. Also, the healthcare provider must communicate to the patient information consistent with this fact sheet. This includes drug interaction information, review the patient's medication list, and identify if there are any drugs that interact with Paxlovid. Administration instructions, counsel the patient to swallow tablets whole and complete the entire 5-day course. Missing doses, educate the patient on what to do if they miss a dose. And describe the packaging. Describe the blister packaging of tablets and how each dose will consist of taking 3 tablets at a time. The cost of a 5-day treatment is approximately $530. The U.S. government will cover the cost of the treatment while the drug is classified under emergency use authorization. In summary, Paxlovid is the first oral antiviral at-home treatment for COVID-19, given emergency use authorization. Paxlovid consists of 2 drugs, Nirmatrelvir, the primary antiviral that works as a protease inhibitor, and ritonavir, an enzyme inhibitor added to boost the levels of Nirmatrelvir. Paxlovid is authorized for treatment of mild to moderate COVID-19 disease in patients who are at high risk for progression to severe COVID-19 infection, including hospitalization or death. Patients must test positive for the virus and start treatment within 5 days of symptom onset. In the EPIC-HR trial, Paxlovid reduced COVID-19 related hospitalization or death from any cause through day 28 by 88%. The drug is taken twice a day for 5 days. Paxlovid is not recommended for use in severe renal or liver disease. Serious drug-drug interactions leading to elevated plasma concentrations can occur with several key drugs and can contraindicate the use of Paxlovid. Healthcare providers should review the patient's medication list and identify if there are any drugs that interact with Paxlovid. The projected cost of one 5-day course of Paxlovid is $530. So what do you think? Is Paxlovid worth it? Well, I've given you a lot of information, but everyone needs to come up with their own decision. And while you're here, take a look at some of the other videos on my channel. Regularly check the description and comments section below for links to updated information regarding the most current issues surrounding Paxlovid. Thanks for tuning in to watch this installment of the PharmEasy Tutor. I hope you learned something that you could use at school or in practice. If you'd like to continue to see more of these types of tutorials on YouTube, please make sure to click on the subscribe button below to change it from red to gray. Also, if you like this video, I would appreciate it if you can click on the thumbs up icon below to change the color to blue. If you have any comments or questions, please feel free to add them in the comments section below or share this site with someone else. Stay tuned to the PharmEasy Tutor channel for more lectures in the upcoming weeks. So until next time, remember to take it easy.